back to reading to myself so that way I focus all the way through. I have a test tomorrow, chapters 6 through 8. I'm reading through section 8.2 right now. And there's all the way up until 8.8. So 8.2 is ovaries, uterine tubes, and uterus. Anatomy of the female reproductive tract. Ovaries, okay. The female gonads, the primary sex organs, are the ovaries. The female internal accessory organs include a pair of uterine fallopian tubes, a uterus, and a vagina. Women are born with all the eggs, ova, that they will release, but it is not until puberty that the eggs mature and start to leave the ovary. The ovarian hormones, estrogen and progesterone, are involved in menstruation and pregnancy, PGY. The pituitary gland at the base of the brain produces other hormones that control the functions of the ovaries, uterus, and breasts. These complex interactions are the core of human reproductive system and an essential part of understanding the human body. Each ovary is an almond-shaped organ located in a shallow depression, ovarian fossa, in the lateral wall of the pelvic cavity. The ovary is about 1 inch, 2.5 centimeters long, and ½ inch, 1.3 centimeters in diameter. It is enclosed in a capsule called the tunica albuginea. Each ovary is held in place by ligaments that attach it to the pelvic wall and uterus. Bam. The ovaries are located on each side against the lateral walls of the pelvic cavity. The right uterine tubes retracted to reveal the ovarian ligament. Uterine fallopian tubes. Each uterine tube is a canal about 4 inches long, extending from the uterus and opening to the abdominal cavity near the ovary. The tubes are supported by the broad ligaments. Each tube has 4 areas. Infundibulum, ovarian end. The outer 1/3 flares out into a funnel shape with finger-like folds called fimbriae. At ovulation, the fimbriae enclose the ovary. And 4 areas. So the next area, the ampulla, widened area, typically the site of fertilization. The third area, the isthmus, the inner 1/3 of each tube approaching the uterus. And the fourth area is your uterine, extends from the isthmus into the uterus. Okay, the wall of the tube has an inner layer of mucosal cells that secrete mucus, some of which are ciliated. The cilia beat toward the uterus and transport the egg down the uterine tube with peristaltic contractions, a journey that takes 3 or 4 days. The adnexa of the uterus are the uterine tubes. The broad ligaments are the adnexa of the uterus are the uterine tubes, the broad ligaments, and the ovaries. Uterus. The uterus is a thick-walled muscular organ in the pelvic cavity. It normally tilts forward, anteverted, over the urinary bladder. Anatomically, it is divided into 3 regions. Fundus, the broad curved upper region between the lateral attachments of the uterine tubes. Body, the mid portion, and cervix, the cylindrical inferior portion that projects into the vagina. The cavity of the uterus is triangular, with its upper 2 corners receiving the openings of the uterine tubes. Its lower end communicates with the vagina through the cervical canal, which has an internal os. Which has an internal os? Is it os or os? Yeah, os. OS. From the lumen and an internal os into the vagina. The cervical canal contains mucus glands. Secretions of mucus help prevent the spread of infection from the vagina. The uterus is supported by the muscular floor of the pelvic outlet and by ligaments that extend into the pelvic wall from the uterus and cervix. The wall of the uterus has 3 layers from outside. These are the parametrium, a continuation of the broad ligament, myometrium, a thick layer of smooth muscle, and endometrium, the lining that sheds in menstruation. The words we have learned are
adnexa,
adnexum,
adnexal,
parts accessory to an organ structure, and adnexa, plural. Adnexum, singular, and adnexal, pertaining to accessory structures, for example, structures alongside the uterus, uterine tubes, and ovaries. And now we have anteverted, tilted forward, anteversion, forward tilting of the uterus. We have endometrium, inner lining of the uterus, and endometrial as an adjective, meaning pertaining to the inner lining of the uterus. We have fimbria, a fringe-like structure on the surface of a cell or microorganism, and we have
fimbria.
It's actually fimbriae, which is a fringe-like structure on the surface of a cell microorganism, but it's talking if it's plural. Then there's fundus, the part farthest from the opening of a hollow organ. Infundibulum, Latin for funnel, funnel-shaped structure. Infundibula, plural version of infundibulum.
isthmus,
Greek for isthmus, part connecting two larger parts, in this case the uterus of the uterine tube. Myometrium, muscle wall of the uterus.
Os,
opening to a canal, for example, the cervix.
ovary
is one of the paired female egg-producing glands.
ovaries
is plural for ovary.
ovarian
is pertaining to the ovary. Parametrium is the covering of the uterus, part of the perineum.
uterus
The uterus is Latin for womb, organ in which an egg develops into a fetus. And then uterine is an adjective for uterus, meaning pertaining to the uterus.
uterine tubes
Tubes connected from the uterus to the abdominal cavity and carry the ovum from the ovary to the uterus.
fallopian tubes,
Also called fallopian tubes. Oogenesis and ovulation. During prenatal development, small groups of cells within the female within the female fetus's ovarian cortex form around 2 million follicles. In each group of cells, there's a single large cell, a primary oocyte, surrounded by a layer of follicular cells. Many of these follicular cells degenerate. Under normal circumstances, there are no further changes within ovarian follicles until puberty. At puberty, some 400,000 primary oocytes remain, each containing 23 pairs of chromosomes. They undergo meiosis to produce secondary oocytes, each containing 23 single chromosomes. As they mature, the follicular cells form a fluid-filled primary follicle in which the oocyte is located. Oogenesis begins in the fetal period and ends at menopause. Surrounding the oocyte, the egg, and lining of the fluid-filled antrum of the follicle are granulosa cells that secrete estrogen. Okay, so we start at the fetus, millions of follicles, each containing a primary oocyte. And then from birth to puberty, there's primordial follicles, each containing a primary oocyte. Primary follicles, each containing a primary oocyte. Moving into puberty. So less than 20 secondary follicles, each containing a primary oocyte. 19 secondary follicles degenerate and are reabsorbed. 1 vesicular follicle containing a secondary oocyte. Okay. Follicle remains in ovary. Oocyte release in the abdomen. Becomes corpus luteum and then releases estrogen, progesterone. Becomes corpus albicans and then degenerates and is reabsorbed, or the oocyte released into abdomen. Fertilized, not fertilized. Okay, not fertilized, it goes expelled with menstrual fluid, and fertilized The oocyte turns into a blastocyst, blastocyst, which turns into a zygote, which turns into embryo, which turns into a fetus, which turns into a baby. Okay, ovulation. At the beginning of the menstrual cycle, as many as 20 primary follicles can start the maturing process, but only one develops fully. The remainder degenerate. By the midpoint of the menstrual cycle, the mature follicle bulges out on the surface of the ovary and ruptures ovulation. The oocyte and lining cells from the follicle can either be taken into the uterine tube or fall into the pelvic cavity and degenerate. Did you know menarche cannot occur until at least 17% of a girl's weight is body fat? I'm guessing that means like a period. High levels of estrogen and progesterone inhibit the secretion of GnRH. This is the basis for most forms of contraceptive medications. During the time that the follicles are developing and maturing, the endometrium is undergoing cyclical changes that are under the influence of hormones. The first phase occurs for 5 days and is the shedding of the endometrial lining. After this phase, the endometrial lining begins to rebuild in preparation to protect and nourish the fertilized egg. In the final phase, the endometrium becomes rich in blood supply, and in the development of glands, the ovum is unfertilized. If the ovum is unfertilized, then the uterine cycle starts over, beginning with the shedding of the endometrium. Ovarian hormones. The ovaries of the sexually mature female secrete estrogens and progesterone. Estrogens are produced in the ovarian follicles. Their sexual functions are to convert girls into sexually mature women, into the onset of breast development, the growth of pubic hair, and the establishment of menstruation. 2, participate in the menstrual cycle. And 3, participate in pregnancy when that occurs. And progesterone is produced by the corpus luteum of the ovary and by the adrenal glands. Its sexual functions are to prepare the lining of the uterus for implantation of the egg. 2, inhibit lactation during pregnancy, and 3, produce menstrual bleeding if pregnancy does not occur. Another graph. Okay. Okay, the synthesis and secretion of estrogen is stimulated by the follicle-stimulating hormone FSH from the pituitary gland. FSH is controlled by the hypothalamic gonadotropin-releasing hormone GnRH. Progesterone production is stimulated by luteinizing hormone LH from the pituitary gland, which is also stimulated by GnRH. The ovaries also secrete small amounts of androgens, male hormones. The uterine menstrual cycle. The menstrual cycle averages 28 days in length. It begins with a 2-week follicular phase. The beginning of the cycle is recognized by physiologists as menstruation, which occurs during the first 3 to 5 days. After menstruation ends, the uterus starts to replace the endometrial tissue lost during menstruation. The developing ovarian follicles mature, and one of them ovulates around day 14. Around this time, the fimbriae of the uterine tube envelop the ovaries. In time, with the mother's heartbeat, caress the released ovum to guide it into the uterine tube. After ovulation, in the post-ovulatory phase, the endometrial lining continues to grow. The residual ovarian follicle becomes a corpus luteum containing lutein cells that are involved in the progesterone production. Around day 24, the corpus luteum involutes. By day 26, it is an inactive scar called a corpus albicans. At this time, the arteries supplying the endometrium of the uterus contract. This leads to ischemia, tissue necrosis, and the start of menstruation. Okay, the words that we have learned.
Antrum.
Antrum, Greek for cave, a nearly closed cavity or chamber.
Corpus albicans.
Corpus albicans. Albicans, Latin for white. Corpus is Latin for body. And atrophied corpus luteum.
Corpus luteum.
Corpus luteum is a yellow structure formed at the site of a ruptured ovarian follicle. Luteum means yellow in Latin.
Estrogen.
Gen, create, estro, woman. A generic term for hormones that stimulate female secondary sex characteristics.
Follicle.
Follicle is the Latin for small sac, spherical mass of cells containing a cavity such as a hair follicle. An adjective, follicular.
Follicular.
Pertaining to a follicle.
Remember in Park City I had a
Gonadotropin.
Gonadotropin, tropin means nourishing, and gonado means gonad. Okay. The hormone capable of promoting gonad function.
Granulosa cell.
Granulosa cell. Osa is light, granule is small grain. Cell lining in the ovarian follicle. Follicle.
Involution.
Involution, a decrease in size or vigor.
Involute.
Involute is a verb for involution. Volute is shrink. In means in. Okay. Menopause.
Menopause.
Permanent ending of menstrual periods. Meno meaning menses. Pause meaning cessation. Menses or menses. Monthly uterine bleeding. Menstruation also means monthly uterine bleeding. Menstruate is a verb. It's the act of menstruation, and menstrual is an adjective meaning pertaining to menstruation. Then you have oocyte, which is a female egg cell. Oogenesis, development of the female egg cell. Okay. Ovulation. Release of an oocyte from a follicle. Ovulate is a verb, to release an oocyte from a follicle. Progesterone, a steroid hormone released by the corpus luteum and involved in the menstrual cycle, pregnancy, and the development of an embryo. So what is a collective as a group medical term for ovaries and the uterine tubes? That'd be a nexa. Another name for the uterine tube is a fallopian tube. The finger-like folds of that envelop the ovary are the fimbriae. The opening of a canal is the os. The term of anteversion prefix means the prefix of anteversion, anti means before, forward. In the term endometrium, the prefix means inner, the inner. Okay, let's see. The permanent ending of menstrual periods is menopause. The release of a female egg is ovulation, which is a correct spelling for the term oogenesis. Ooganesis. At which stage of human growth follicles are developed? That would be fetal. Oocytes are contained in the follicle, I believe, or corpus luteum. The fluid-filled area of the follicle is granulosum. Okay, a decrease in size or vigor is involution. Decrease in size or vigor is, involution. We have hormone that prepares the uterus for pregnancies, progesterone. The act of menstruation is menstruate. Hormone that promotes females' secondary sex characteristics. Sex characteristics is estrogen. Development of a female egg cell is oogenesis, and pertaining to a follicle is follicular. Okay. We are on 8.3, disorders of the female reproductive tract. Disorders of the external genitalia and vagina. Bacterial vaginosis is the most common cause of vaginitis in women of childbearing age. In bacterial vaginosis, the different types of invading bacteria outnumber the normal bacteria of the vagina. The main symptom is an abnormal vaginal discharge with fish-like odor. Diagnosis is made by a laboratory examining of a specimen taken by vaginal swab. We have toxic shock syndrome. This is life-threatening illness caused by toxins circulating in the bloodstream. Certain rare strains of bacteria produce these toxins. And the most common form of toxic shock syndrome, the bacteria are in the vagina of women, and their growth is encouraged by the presence of a superabsorbent tampon that is not changed frequently. Vulvovaginal candidiasis is a common cause of genital itching or burning with a cottage cheese vaginal discharge. It is caused by an overgrowth of the yeast fungus called Candida and can occur after taking antibiotics. Recent research has found that it is associated with vitamin D deficiency. Diagnosis is made by microscopic examination of a specimen taken by vaginal swab. Allergic and irritative causes of vulvovaginitis can be caused by vaginal hygiene products, spermicides, detergents, and synthetic underwear. Vulvodynia is a chronic, lasting, severe pain around the vaginal orifice. which feels raw, painful intercourse. Dyspareunia is common. The vulva may look normal or be slightly swollen. The etiology is unknown. Bacterial vaginosis is associated with increased risk of gonorrhea and human immunodeficiency virus (HIV) infection. 75% of adult women have at least one genital yeast infection in their lifetime. 10 million office visits annually for vulvodynia. And vaginal cancers are uncommon, compromising 1 to 2% gynecological malignancies. They can be effectively treated with surgery and radiation therapy. Okay, the words we have learned. Candida, a yeast-like fungus.
Candidiasis.
Infection with the yeast-like fungus, Candida.
Dyspareunia.
Dyspareunia is pain during sexual intercourse.
Vulvodynia.
Vulvodynia is chronic vulvar pain.
Vulvovaginitis.
Vulvovaginitis is inflammation of the vagina and the vulva. Sexually transmitted diseases. According to the Center for Disease Control and Prevention, CDC, 50 million cases of sexually transmitted diseases, STDs, are reported annually in the United States, with adolescents and young adults being at the greatest risk. Some of the common STDs are described as follows. Chlamydia infection, known as the silent disease because infected women and men have no symptoms. When there are signs of vaginal or penile discharge and irritation with dysuria are common. They can be passed to a newborn during childbirth, causing eye infections or pneumonia. It is a reason why antibiotic eye drops are given to newborns. Gonorrhea is spread by unprotected sex and can be passed to a baby in childbirth, causing serious eye infection. This is another reason why newborns are given eye drops. Symptoms in both male and female adults may not be present. In a female, they can include vaginal discharge, bleeding, and dysuria. Gonorrhea is also a cause of PID. Syphilis caused by spirochete is transmitted sexually and can then spread through the bloodstream to every organ in the body. It is also transmitted along the intravenous drug users who share needles. Primary syphilis begins 10 to 90 days after an infection as an ulcer. A canker.
I've been going to the one in Cameron Park.
At the place of infection. 4 to 10 weeks later, if the primary syphilis is not treated, secondary syphilis appears as a rash on the hands and soles of feet with swollen glands and muscle and joint pain. Tertiary syphilis can occur years after primary infection and can cause permanent damage to the brain with dementia. Because primary syphilis is curable with penicillin or other antibiotics, tertiary syphilis is rarely seen today. A pregnant woman with untreated syphilis can transmit the infection to her fetus before birth. A cankeroid is an ulcerative disease not caused by a spirochete.
That's where I'm working.
How do you say this?
I'm working back there off Slager Mine Road, and so you can take Spanish Dry Diggins Road all the way, and then it hits Slager Mine.
Spirochete.
Spirochete.
Right there.
Holy fuck. These pictures are so graphic. Okay. Spirochete. It's not caused by a spirochete and is without system-wide effects. Unlike syphilis, it develops as a canker with swollen, tender lymph nodes in the groin. Trichomoniasis. Trich is caused by a parasite Trichomonas vaginalis. Men can carry the infection in their urethra and almost never have symptoms. The vagina is a common site of infection for women. It can produce frothy yellow-green discharge with irritation and itching in the vulva. It's called a ping-pong infection because both partners are not treated. The infection will be given back and forth to partners. An infection with gonorrhea can be prevented by using a condom. A DNA probe is a diagnostic test where a sample of the affected area is taken with a cotton swab. The sample is then analyzed for the presence of the DNA bacteria Chlamydia trachomatis and in gonorrhea. Molluscum contagiosum is caused by a virus that can be sexually transmitted. The resulting tumors are small, shiny bumps that have a milky white fluid inside. They can disappear and reappear anywhere in the body. Molluscum contagiosum is often seen in children and not sexually transmitted. In such cases, pelvic inflammatory disease, PID, is caused by the upward movement of microorganisms from the cervix and vagina into the uterus. The uterine tubes and ovaries. It is often caused by chlamydia or gonorrhea. However, recent studies suggest that it may be associated with other bacteria. molluscum contagiosum or contagiosum. I don't think I should show any of these next ones. Okay, genital herpes simplex is a disease caused by the virus herpes simplex 2, HSV2. The sores are painful and the disease can present with fever, joint pains, and enlarged tender lymph nodes. The genital sores can reoccur throughout life. After the initial infection, the virus remains dormant in the dorsal root ganglia of the nerves. Blisters around mouth. Cold sores are caused by related viruses, herpes simplex, HSV1. Herpes in the newborn occurs when pregnant woman with genital herpes sores delivers her baby vaginally and transmits the virus to the baby. Because the baby's immune system is not well developed, the infection is destructive and can be fatal. If there is evidence of genital herpes lesions in the mother, the fetus should be delivered by cesarean. Human papillomavirus. HPV causes genital warts in both men and women and can also cause changes to the cells in the cervix. Some strains of the virus can increase a woman's risk of cervical cancer. Fuck. Medications such as podophyllin, trichloroacidic acid, and Aldara cream can be applied to the warts, and cryotherapy or laser therapy also can be used. Because of the size of the warts around the genitalia, condoms cannot provide complete protection. Human immunodeficiency virus. HIV is a virus that attacks the immune system and can lead to acquired immunodeficiency syndrome, AIDS. Because HIV is carried in body fluids, it is transmitted during unprotected sex. Sharing needles can also spread the virus. The virus can also pass from an infected pregnant woman to her unborn child, and she can take medications. She must take medications to protect the baby. Symptoms often do not appear until years later after the initial infection. The initial symptoms of HIV is similar to a flu. A person is diagnosed with HIV positive during a blood test that identifies antibodies to the virus, ELISA, with a confirmatory Western blot that identifies the specific antibody proteins. The CDC considers an HIV-infected person with CD4 count below 200 to have AIDS. Whether the person is sick or well, CD4 cell, also known as T cells, may play a role in the body's defense mechanisms. Okay, so we have acquired immunodeficiency syndrome.
Acquired immunodeficiency syndrome.
Infection with HIV virus. Acquired, Latin to obtain. NC condition, immune response deficiency, lacking or inadequate, sin together, drum, running, chancre?
Chancre.
A chancre. Latin for cancer, primary lesion of syphilis.
Chancroid.
Chancroid is a chancre, oid, meaning resembling, infectious, painful, ulcerative STD, not related to syphilis. Chlamydia, Latin for cloak, a species of bacteria causing an STD.
Gonorrhea.
Gonorrhea, rhea's flow or discharge. Gon means seed. Specific contagious sexually transmitted infection. Herpes simplex virus, HSV.
Herpes simplex virus.
Herpes Greek for spreading
HSV.
Spreading skin eruption virus, meaning poison, an infection that manifests with painful watery blisters of the skin and mucous membranes.
Human immunodeficiency virus, HIV.
Latin for human for human being, NC condition, immune response, deficiency, lacking, inadequate, virus poison, etiologic agent of age. Then we have HPV.
Human papillomavirus, HPV.
OMA is tumor, papillomans pimple virus is poison, an infection that causes warts in the skin and genitalia and can increase the risk of cervical cancer.
Molluscum.
Mollusk is soft, is structure, Latin is to touch closely. STD caused by a virus. Opportunistic infection. Let's see, an infection that causes disease when the immune system is compromised for other reason.
Spirochete.
A spirochete. Spire meaning spiral and chete meaning hair. Spiral-shaped bacterium causing an STD, syphilis.
Syphilis.
Syphilis, possibly from Latin poem Syphilis, Civ Morbis Gallicus by Fracastorius. Alteration, a sexually transmitted disease caused by a spirochete.
Trichomonas.
Trichomonas, a parasite causing an STD.
Trichomoniasis.
Trichomoniasis is an infection with Trichomonas vaginalis. Okay. Trich meaning hair or flagellum, mon meaning single, iasis condition. HIV damages the immune system, so infections will develop that the body would normally cope with easy. These are opportunistic infections that includes herpes simplex, candidiasis, syphilis, and tuberculosis. The peak incidence of ovarian cancer is in women in their 50s and 60s. Residual scarring of the uterine tubes from salpingitis is a common cause of infertility. Disorders in the ovaries. Ovarian cyst and cancer. An ovarian cyst is a fluid-filled sac in the ovary. Most cysts are normal and are called functional cysts. They follow ovulation and disappear within 3 months. Polycystic ovarian syndrome, PCOS, is in which multiple follicular cysts form in both ovaries. Because of the repeated cyst formation, no egg matures and is released. Ovulation does not occur and progesterone is not produced. Without progesterone, the menstrual cycle is irregular or absent. Now, what does cysts look like in your ovaries? Okay, and let's see. The cysts produce androgens, which prevent ovulation and produce acne, the male pattern hair loss in the front of the scalp, and weight gain. In addition, women with PCOS make too much insulin, which interferes with normal fat metabolism and prevents it from being used for energy. This leads to difficulty in losing weight, causes patches of dark skin. Women with PCOS are also increased risk for endometrial cancer, type 2 diabetes, high blood cholesterol, hypertension, and heart disease. Ovarian cancer is the second most common gynecological cancer after endometrial cancer, but it accounts for more death than any other gynecological malignancy. Symptoms develop late and are usually vague, making early diagnosis difficult. A mass in the abdomen may be detected during routine pelvic examination. Disorders of the uterus and uterine tubes. Primary amenorrhea occurs when a girl has not menstruated by age 16. This can occur with or without other signs of puberty. There are numerous possible causes: drastic weight loss from malnutrition, dieting, bulimia, and anorexia nervosa. Extreme exercise, as in some young gymnasts, extreme obesity, chronic illness, congenital abnormalities of the uterus or vagina, and congenital hormonal disorders. Secondary amenorrhea occurs when a woman who has menstruated normally then misses 3 or more periods in a row and is not in her menopause. That causes include pregnancy, by far the most common cause, ovarian disorders such as PCOS, excessive weight loss, low body fat percentage, excessive exercise, as in marathon runners, certain drugs, including antidepressants, and stress. Primary dysmenorrhea or premenstrual syndrome, PMS, refers to pain or discomfort associated with menstruation. The pain can begin 1 or 2 days before menses, peak on the first day of flow, and then slowly subside. The pain can be cramping or aching and be associated with headache, diarrhea, constipation, and urinary frequency. Secondary dysmenorrhea is pain associated with disorders such as infection of the genital tract and endometriosis. Endometriosis is said to affect 1 in 10 American women of childbearing age. The endometrium becomes implanted outside the uterus on the uterine fallopian tubes, the ovaries, and the pelvic peritoneum. The displaced endometrium continues to go through its monthly cycle. It thickens and bleeds, but because there is nowhere for the blood to go, it leads to cysts and scar tissue and produces pain. The etiology of endometriosis is unknown.
Amenorrhea.
Amenorrhea is absence of or abnormal cessation of menstrual flow.
Dysmenorrhea.
Dysmenorrhea is painful and difficult menstruation.
Endometriosis.
Endometriosis is an endometrial tissue of the abdomen outside the uterus.
Polycystic.
Polycystis is composed of many cysts.
Premenstrual.
And premenstrual is occurring before menstruation. Okay, uterine prolapse. The uterus is normally supported by muscles, ligaments, and connective tissue of the pelvic floor. Difficult childbirth can weaken these tissues so the uterus can descend into the vaginal canal. Aging, obesity, lack of exercise, chronic coughing, chronic constipation are also thought to play a role in the development of prolapse. If the uterus is tilted backward toward the rectum, its position would be retroverted, a condition found in 20% of women. Uterine prolapse can be accompanied by prolapse of the bladder and anterior vaginal wall called cystocele. or cystocele, or of the rectum and posterior wall of the vagina called rectocele. Let's see how to say this.
Cystocele.
Okay.
Rectocele.
Okay. Signs and symptoms of a prolapse include incontinence, pelvic pressure, difficulty with inserting tampons, and seeing or feeling a bulge coming out of the vagina. Uterine fibroids. Fibroids are non-cancerous growths in the uterus that appear during childbearing years. 3 out of 4 women have them, but only 1 out of 4 women have symptoms from them. The symptoms they can produce include menorrhagia, abnormally long, heavy menstrual bleeding, metorrhagia, metrorrhagia, and irregular bleeding between menstrual periods, polymenorrhea, 2 frequent periods occur more often than every 21 days, and no ovulation in the cycle. And pelvic pressure, low back pain, urinary incontinence, and frequency. Uterine fibroids are also called fibromyomas, leiomyomas, or myomas. They arise in the myometrium, producing a pale, firm, rubbery mass separate from the surrounding tissue. They vary in size from seedlings to large masses that distort the uterus. They can protrude into the uterine cavity, causing menorrhagia, or project outside the uterus and press on the bladder or rectum to produce symptoms. Leiomyoma. In this sectioned uterus, a small rounded leiomyoma is present, causing a small rounded bulge in the uterine wall. The larger mass at the top is another leiomyoma projecting from the surface of the uterine cavity. Other causes of uterine bleeding. Dysfunctional uterine bleeding, DUB, is term applied when no cause can be found for a patient's menorrhagia. Endometrial polyps are benign extensions of the endometrium that can cause irregular or heavy bleeding. They can be removed by hysteroscopy or D&C. And then we have menopause is diagnosed when a woman has not menstruated for a year and is not pregnant. She is in the change of life. In this normal, natural, biological process of reproductive aging, levels of estrogen and progesterone start to decline around the age of 40. For most women, menstruation ceases between 45 and 55. Significant qualities of estrogen and progesterone are no longer secreted, so the endometrial lining of the uterus cannot grow and be shed as a normal menstrual period. Without estrogen and progesterone, the uterus, vagina, and breast atrophy, and more bone is lost than is replaced. Blood vessels constrict and dilate in response to changing hormone levels and can cause hot flashes. Whew, fucking menopause. Okay. Cystocele. Cele meaning swelling, and hernia, cystobladder. Hernia of the bladder into the vagina.
Dysfunctional.
Dysfunctional is having difficulty in performing. Dys is painful or difficulty.
Fibroid.
Fibroid, oid resembling fiber. Uterine tumor resembling fibrous tissue.
Fibromyoma.
Fibromyoma, also called
Fibroid.
Also called a fibroid, benign neoplasm derived from smooth muscle containing fibrous tissue.
Leiomyoma.
Leiomyoma. Lyo meaning smooth, my meaning muscle, oma meaning tumor mass. Benign neoplasm derived from smooth muscle, also called
Fibroid.
Menopause. Meno meaning month or menses, pause meaning cessation, permanent ending of menstrual periods, adjective.
Menopausal.
Pertaining to menopause.
Menorrhagia.
Menorrhagia
Or
is...
menorrhagia.
Oh, I didn't even see that. Okay, excessive menstrual bleeding.
Metrorrhagia.
Metrorrhagia is
Metrorrhagia.
okay. Irregular uterine bleeding between menses.
Myoma.
A myoma is a benign tumor of muscle.
Polymenorrhea.
Polymenorrhea is more than normal frequency of menses.
Prolapse.
Prolapse, Latin
Or prolapse.
for a falling, the falling or slipping of a body part from its normal position.
Rectocele.
Rectocele, seal meaning swelling hernia, rectum, hernia of the rectum into the vagina.
Retroversion.
Retroversion, the tipping backward of the uterus.
Retroverted.
Retroverted is tilted backwards. Endometrial cancer is the fourth most common cancer in women after lung, breast, and colon cancer. 40,000 new cases are diagnosed each year, mostly in women between ages of 60 and 70. The most common symptom of vaginal bleeding after menopause. It is also can cause a vaginal discharge, pelvic pain, and dyspareunia, higher levels than normal of estrogen that are thought to be a risk factor for endometrial cancer. Cervical cancer is less common than endometrial cancer, but 50% of cases occur between ages of 35 and 55. In 2020, it is estimated that 13,800 cases of invasive cervical cancer can be diagnosed in the United States. Early cervical cancer produces no symptoms or signs that may be found in the routine Pap test. In cancerous stage, abnormal cells, dysplasia, are found only in the outer layer of the cervix. 13 types of human papillomavirus can convert these dysplastic cells to cancer cells. A vaccine has been developed that makes people immune to two of the most common types of HPV, uterine fallopian tubes. Salpingitis is an inflammation of the uterine fallopian tubes and is part of the pelvic inflammatory disease. A bacterial infection often found from an STD spreads from the vagina through the cervix and the uterus. Symptoms are lower abdominal pain, fever, and vaginal discharge. Female infertility. Infertility is the inability to become pregnant after 1 year of unprotected intercourse. It affects 10 to 15% of all couples. The causes due to infertility are due to the female factor alone, 35%, the male factor alone, 30%, male and female factors in 20%, unknown factors 15%. Cervical cancer is extremely rare in women under 25. Approximately 20% of women now have their first child when they're age 35 older, and 20% to 30% of female infertility problems, no identifiable cause is found. The success rate of IVF is approximately 30% for each egg retrieval. In women, fertility begins to decrease as early as age 30, and pregnancy rates are very low after age 44. Causes of infertility in the female. Infrequent ovulation is responsible for 20% of the female infertility problems when both ovulation and menses occur at intervals of longer than a month. Bulimia, anorexia nervosa, rapid weight loss, excessive weight training, or excessive exercise training, low body weight, obesity, and polycystic ovarian syndrome are among the causes. Scarring of the uterine tubes is responsible for 30% of male infertility problems. Scarring can result from previous surgery, previous tubal pregnancy, pelvic inflammatory disease, or endometriosis. The scarring blocks the sperm from reaching the egg. Structural abnormalities the uterus are responsible for 20% of female infertility problems. Fibroid tumors, uterine polyps, and scarring from infections, abortions, and miscarriages can all produce abnormalities of the uterus. This abnormalities also block the sperm from reaching the egg. Did you know? The combining form metro will be used to describe bleeding that is irregular. The combining form meno will be described to describe bleeding that occurs at regular intervals. We have dysplasia, abnormal tissue formation. Dysplastic is pertaining to abnormal tissue function. Infertility, inability to conceive over a long period of time. Infertile. Okay, and then we have salpingitis, inflammation of the uterine tube.